How was your Thanksgiving?
It was good. It was good.
Nice. Doing the were you stayed in town or did you travel? Do any traveling or
Yeah, we just stayed in town. Nothing
nice.
crazy.
Very nice. I'm gonna do something a little different today. We're gonna wait till obviously we're gonna wait till 1:35 to start, but I got a little trivia. We're gonna get the brain juices flowing.
Okay.
I,
Attendees
I,
hearing us?
yeah, everybody that's in here so far, just put a comment or emoji that you guys can hear us okay. You can see us on camera and all that good stuff. And we'll be getting started here very shortly. Got a couple more minutes. Wait on some of the stragglers to get in here. I'm getting some emojis. No chats yet, but I'm getting emojis, so I'm assuming that we're okay. Everybody can hear us. Everybody can see us.
Oh, good.
Yeah, today's going to be an interesting topic. We're going to be talking about obviously HIPAA compliance with fax machines, and yeah, um, it's just one of those common sense things, Jose, that I'd
Oh,
say
you know what they say about common sense.
uh, it's a superpower.
Yeah, man. It's impressive.
See, we got a couple more in here. We'll give it one more minute to get going. Linda, thanks for joining in. Susie, thanks for joining in. We're going to wait about another minute and then we'll go ahead and get started. I want to do something a little different this webinar. I want to do it just a quick little trivia and see where everybody's heads are at here. get the brain juices flowing. Let me go ahead and share my screen, make sure that looks good. Jose, let me know if you can see.
Yep.
Perfect. And Jose, you can't participate in this, by the way.
Oh, don't worry.
So hold your tongue.
I will.
All right, cool. Let's get started. So, guys, I appreciate you joining in today. For those that are just joining now, want to do something a little different. I don't know if you guys were at the last week's webinar, but we just want to do a quick little trivia, see where everybody's heads are at, get the brain juices flowing. It's lunchtime for some people right now. Might be afternoon for some, might be breakfast time for some as well. So let's go ahead and get this started. First question. According to HIPAA regulations, how long do new hires typically have to complete their training? Is it A, 5 days, B, 10 days, C, annually, or D, biannually? And you guys can just leave a comment with your answer. Kathleen says B. Linda says 10 days. Everybody's saying B right now. I might have threw a little trickery in here, so I'll give it another 10 seconds here. Susie. Yes. Susie's changing it up. So the answer is actually C. It's annually. So again,
Hold
we've
on
done
though,
just
Ray. Hold on though, Ray.
uh-oh.
Hold on though, Ray.
Uh-oh.
Look at the way you asked the question. New hires.
Yes.
Yes. They have to do their annual training within the first 10 days. Once the initial HIPAA training is complete, then they go to the annual. So the answer
So did I
you're
just get
looking
my own
for
question
based
wrong? Is
yes.
that
So
what you're
the
telling
answer
me?
to your
Get out
question
of here.
is B. The
Uh
question you intended was C.
my intention was C. I tricked myself. There you go.
The
So
the part that messed you up, Ray, was the new hires.
okay. So guys, I just got duped
Gosh.
by my own co-host. I actually tricked myself. So yes, Jose is right. 10 days, and then after that, It's essentially on an annual basis. Thanks, Jose. So we got one more question. What are the potential consequences of non-compliance with HIPAA regulations? Is it A, heavy fines, B, lawsuits, C, potential loss of business and or medical license, or D, all the above? Getting a lot of D's right now. I'd say that's you guys are on the right track. I don't think I got this one wrong. We'll give it
Well,
another
this
10
one's
seconds.
important. This
Yeah,
one's important based on
this
the
one is,
conversation we're gonna have today,
yes, it is. Yes, it is.
because of the different factors involved.
So the answer is D, all the above. So that's all I got for now for the trivia. I appreciate you guys participating with that. And let's go ahead and dive into the substance and today's topic. So again, thank you guys for joining in on today's webinar. Today, or again, my name is Ray Walters. I'm going to be today's host. I'm also accompanied by my co-host, Mr. Jose Delgado. For
How you
those of
doing,
you that are
everybody?
just joining in, appreciate you being here. Jose was actually on our last webinar. We were talking about HIPAA security and cell phone workstation use. Today's subject, we're going to be talking a little bit about HIPAA compliance with faxing and facility access controls. Just a little bit of background on Jose. He has over 17 years of experience in healthcare business development, healthcare management, as well as consulting. And his latest venture is he also is a co-owner of a mental health clinic. And Jose, anything else to add there?
Not really. I mean, you pretty much hit it on the head. For today, you'll be able to know you'll be able to peek into some of the issues that you and I have tag teamed on several clients on the consulting side and on the epi compliance side that have had issues with this specific topic.
Absolutely.
So we'll go over the details of it as we go through, but make sure the TLDR, make sure you know who owns the device.
Of course. Of course. And obviously before we get started into the meat and potatoes, do want to give you guys just a brief background of epi compliance. We've established in 2013. Our focus is healthcare compliance, specifically in HIPAA privacy, HIPAA security, OSHA for healthcare, and Medicare regulations. Our mission is simple. We want to help streamline the compliance process for healthcare organizations, students, and business associates alike. Again, we founded Epi Conferences as well, which is a in-person event. And a part of this event, it's revolves around healthcare innovation and compliance. But something unique about this event is we also host a in-person certified HIPAA security officer training program. And again, we recommend anybody that is an Epi compliance user, anybody that's a healthcare administrator, healthcare business owner, a healthcare student, that might be getting into administration, recommend taking this training. Gives you a much bigger perspective on HIPAA and all the rules and regulations behind that. Jose is actually one of the instructors for this course as well. Jose, do you have anything to add to that?
The boot camp is 8 hours of just us going over HIPAA security. We try to make the dry material not so dry with different real world examples and different examples that are currently within the media. So that's always fun. Lawyers and people making mistakes tends to keep us on our toes, and um, explaining how those loopholes are taken advantage of by different hackers or different organizations allows for everybody kind of be ready for that kind of stuff. So
Right, right. And this is also a training that we're going to be offering here online very soon. Stay tuned for that. We're hoping to have this course up and online by the first quarter of 2024. So stay tuned for that. And without further ado, let's talk about some of the objectives that we're going to be talking about today. We're going to be covering the key aspects of understanding facsimile and HIPAA, evaluating HIPAA compliance and faxing, recognizing challenges in traditional faxing, implementing best practices, also exploring modern alternatives to faxing, and obviously enhancing security through employee training. So, Jose, for our audience's
I mean, if you don't know
understanding,
what a fax is, it's
yeah,
only because you're a Zoomer and you've never worked in an office before. But I mean, many, many moons ago when when the internet was not as much of a thing, this was the fastest way to get actual documents passed along from one point to another. You'd have a printer on one end, you have a printer on the other end, you'd send the image through the phone line, and then boom, on the other side, you get a piece of paper. So, for a lot of for a variety of reasons, faxing is not as popular or as prevalent. But I mean, even in our small office, we get probably 25 to 40 pages worth of faxes a day, and that's even with us having fax to email. Just the way that the things that we end up having to print out to add to the record or anything like that.
I was going
So
to say, would you say it's
it's
the faxes that were incoming? Are they more so
they're
medical
all
record
incoming.
related, or
Yeah, it's
gotcha?
always patient related information. Um, I mean, they used to even do set targeted sales. Just hey, here's let's waste some ink and toner on somebody wanting to sell us a DME referral. We're
Jeez.
mental health, bro. We don't do that,
Right.
but it's kind of impressive the way that faxes used to be used. But for the same reason, HIPAA was a problem. HIPAA was a big, big problem, especially if your provider has a very popular last name, or if you're in a market where multiple companies are using similar names. So hey, we're Acme Pain Management. Oh, we're pain management of Acme. That a lot of times that can be an issue, or same with one number being different on the fax. All of a sudden, we're
Sure.
getting an orthopedic surgeon stuff. So it's there are a lot of issues with faxes.
Yeah, that kind of leads into my next question. Is faxing considered HIPAA compliant? Um,
So again, everything is HIPAA compliant until the human element comes involved, right? Because when it's stored, it's fine. It's just where is it being transmitted to, who has access to it, all of that fun stuff. So I mean, yes, as far as messaging goes, it is one of the most HIPAA compliant because it goes straight to another number. There's
mhm,
no true in between point. Not like a lot of emails that can just be spoofed and then sent to three different emails, right? This is just all right. This goes directly to this other fax number. It's just inefficient for a lot of things.
is it safe to say once a fax is sent, there's no rescinding it? It's it.
Oh, I mean, yeah, it's gone. There's no, oh, oops, I
Yeah,
sent it to the wrong place. Nope, you better figure out where that's going and
I've seen that
call
situation
ahead.
occur before, 100%, and that is definitely a negative to faxing.
Yes, yes.
So that kind of brings me to my next question. What would you say there's some challenges associated with traditional faxing when it comes to HIPAA compliance? Obviously, mentioning once you send it, it's it.
So before we even get there,
Yeah.
there's two issues with fax machines that I see on the day-to-day basis now.
Mhm.
One is who actually owns the fax machine? Does the practice own it outright? Or is there an IT company, or is there a leasing company? Whoever actually owns that fax machine is a business associate,
Sure.
because they're going to be the ones in charge of replacing the fax machine, maintaining the fax machine, making sure that everything is going well just on the hardware software side of that device. And a lot of times, what we'll have is, all right, if it's a leasing company, which a lot of offices do, ours does it, it's cheaper for us to lease it for 2 years. Then they just take that one and bring us a new one. And Every 2 years
Right.
we get a new fax machine. What I tell them is you've got two options. You can either take that hard drive and Hillary Clinton it and show me that you Hillary Clinton it, or give me the hard drive so I can do it.
Right.
But I want to know that the hard drive is handled. So this is where we want to make sure that that reuse isn't just, oh, they just turned around, cleaned it up, updated the software, and then sent it back out to somebody else. That can be an issue.
You would
So definitely make sure that's handled that way.
you raise a good point. Would you say so? Just out of curiosity, the fax company that you're leasing through, do they understand that dynamic in terms of, hey, we're replacing your fax, we're gonna wipe the hard drive, or is it because it sounded like you're the one that you have to ask them to do it, right? Should they
So
technically know these things?
they
Um,
should know these things. It is
right.
far more prevalent that they know these things now
Hmm.
than 3, 4 years ago, especially pre-COVID, the era known as pre-COVID. Pre-COVID, these leasing companies wanted nothing to do with HIPAA. They would much rather look, we'll just give you the hard drive. I don't even want to hear the words HIPAA because they understood it as expenses to them.
Sure.
Especially because a lot of these printer companies, if you got them directly, they really didn't want to deal with the issues that come with knowing you have a potential HIPAA exposure. So this is where you'd have a lot of BAA issues involved. This is where a lot of IT companies were like, okay, well, we'll handle the leasing because then they can make a little bit of residual on the side, and then they can also control what devices are on their networks, and um, it would sometimes expedite the process. But again, knowing who actually owns the fax machines can really alleviate some of your headaches. And
Sure.
sometimes it's just an easy BAA and an easy solution. Hey, if you're in a certain area where you like to go shooting, it's not that hard to go shoot a hard drive. It's not that hard to take
Right.
a
No,
hammer to a hard drive.
but you raise a good
If
point.
Clinton can do it, I can do it.
I'd say one of the more important things, or one of the basic things you got to have in place, especially if you're leasing, is a BAA agreement, right?
You
That's
gotta
that's a
have the
must,
BAA is nice and tight.
right?
I would always recommend, when possible, you be the one that send the BAA. Don't be the one that receives the BAA. But larger organizations are just going to be like, screw it. This is our BAA. This is all we're going to take responsibility for. At that point, something is better than nothing. Just make sure you review it,
No, absolutely.
because there may be some clauses in there where they're like, hey, we're not going to take responsibility for anything. And then is it really a BAA, or is it just them saying you can't hold us liable?
Right.
So
No, good point. Good point. Obviously, have a professional review that BAA agreement as well.
yeah, if not, you'll
Always
get you
recommend it.
if yeah, you got to take a look at it. You got to have somebody that knows what they're looking for, because if not, you're just going to end up falling asleep reading the damn thing.
Agree. So, moving forward, let's talk about some solutions. Jose, how can organizations make their fax machines HIPAA compliant?
So for one, you can make sure that the fax machine is one, you can just have it on the same Wi-Fi as all of your other company devices. Don't let the IT or the printer company just put it on whatever Wi-Fi is easy for them. You tell them, no, you want that IP on a specific Wi-Fi. If it doesn't happen, what ends up happening is end up having problems with connectivity between devices that are on one Wi-Fi to dealing with another Wi-Fi. And anybody said to set up a fax machine, you guys know what I'm talking about. There's nothing more annoying than a fax machine or a printer that doesn't connect to the device that you need it to.
Right.
Because everybody's going to tell you turn it off and turn it back on, and that's not the freaking problem. It works just fine, just not with this computer for this reason. And it's always the one that's closest to it. It's never the one that's furthest away. I don't know why that happens. One of the other things you want, obviously, is not making sure your fax machine isn't in your patient waiting area. Doesn't make any sense. Don't leave it in the hallway. But for ease of use, most people don't do that anyways. They put it in
Sure.
their bullpen. So that one's fine. Limit access to authorized personnel. I mean, you just got to make sure that only people that need access to it have access to it. I'll be honest with you, at our office, our providers don't have access to the fax machine. They don't need it. Our fax machine is actually even our printer.
Sure.
And because of the way that there's no reason for business purposes that any of our providers in our mental health setting need to print anything. The reason is because one, it's mental health. What are you doing?
Sure.
Two, you don't need to fax anything. You don't need to print anything because you can just send it by email. Or what more than likely happens is that anything that needs to be faxed, printed, or sent anywhere, they're telling somebody else to do it for them because they're a provider, and that's the way providers work.
I was
So
gonna
the
say, for
reality of the matter is
liability
that
purposes, it doesn't make sense for the provider to
yeah,
send
it
the
doesn't. It just
fax.
doesn't make any sense. And then it's one more person. I got to teach a new machine every two
Yeah.
years. It's just there's no point. It's usually just hey, they try to fumble around, and somebody says, "Before you break it, what are you trying to do?"
Right.
And then somebody else handles it usually. Um, so yeah,
That's a
so
good
you
point.
want to limit that access to only the people that need it, because again, there's going to be PHI coming out of that fax machine.
Yes.
So I mean, do you really want, your accounting office to be having access to the same fax machine that your medical records, that your new patient, your MA bullpen? No, they don't need the same level of access. They don't even need access to the same machines. So what are you doing? Now that
Right.
also brings up the whole, do we even really need a fax machine nowadays with all the other things coming on? But we're getting a little ahead of ourselves.
No, that's no,
Um,
no, good segue. And that's essentially the next slide, and going back to that, what are, you know, modern alternatives that healthcare organizations can use versus the traditional faxing methods?
so the answer to that is always going to be what's the best tool for what your office needs,
Right.
right? So for my office, most of my providers are not in the office, so they're not driving my staff crazy, so they don't ever need access to the fax machine one more time, right? But so how do we get them access to the documents that are faxed to us or to the office? You got your EMR, EHR, where any PHI, it's uploaded to the appropriate medical record, you're good to go. Other situations where maybe you need to have access to certain faxes, like if it's a prior authorization or
Mhm.
something that needs to be signed and then sent back, because insurances are still doing things the 1990s way because they're insurances. um then you may need something that is a fax to email or a fax to print or one of the cloud sharing services mentioned here. There are literally hundreds of different ways to skin that cat. It all depends on what is the most useful for you. When you're considering this stuff, make sure that you understand what is the exposure on the HIPAA side. So is there encryption? Is there no encryption? Is there a special application that I need on the device to be able to view the information? Is this something that I log into where everything is faxed to, and then I pull the fax? For example, we use Practice Fusion at our office,
Mhm.
and I believe Allscripts has the same thing because they own Practice Fusion. We have a company that we use called UpDocs, where all of our faxes go to that
It's like a digital,
application.
yeah,
Yeah, it's all digital.
digital
And
form.
then we can actually go and say, okay, yeah, go ahead and print it. Or I can go and say from my house here, hey, no, I'll print it from over here. That way I have quicker access to it than printing it at the office, driving to the office, signing it, and then putting it away. Like it's
Sure.
no. So then you have the same problem as before, where if it's a mobile
So
device,
why
your mobile
Wi-Fi,
device is acting
right?
as it's acting as your fax machine. So
Yep.
again, who owns the device? So but yeah, absolutely. A lot of these tools, don't look for something that gives you another thing you have to pay for. I will bet dollars to donuts that if you're a medical practice in 2023 in the United States, an application you're currently using has the ability to fax the email or fax to a box. You just may not know about it,
Mm,
or you may not be using that ability, but dollars and donuts, you have a way to do it.
sure, sure. No, good points. And again, Jose, you corrected me earlier on my trivia. I'm, s- I'm never gonna live that down. But obviously, I put that question in there because again, when it comes down to HIPAA security, HIPAA privacy, training is important. Obviously, it was mentioned earlier, have to have policies, procedures in place. Who has access to the fax machine? Is it in a secure location, et cetera? Who's having that BAA in place with the leasing company so that if they're replacing the fax machine, you're making sure that data is getting wiped completely. But again, the emphasis is training. And Jose, how can organizations enhance security or enhance HIPAA security training for faxing?
So there's really three ways to do this. There's the most difficult way, which you'll see in a lot of accounting and legal firm, where everybody who has access to a fax machine or a printer has a specific code. This they use it a lot for billing out their client, but realistically, it's also a tool that they can use as an audit trail to see who faxed what, when, and where. Um, it's they use it for proof, but for us, it's also a proof of who sent it. So I'm in Northeast Florida, Dr. Smith, or Dr. Singh. There's like 4 Dr. Smiths in my area. How do we know we sent it to the right one?
Hmm.
What is the protocol for we sent it to the wrong Dr. Smith? Did we catch it or did the incorrect office catch it? So you want to have protocols for all of it. And again, depending on what's going on is the severity of um the sanction should be, like, hey, all right, I sent a prior auth to the wrong primary care. Okay, well, there isn't that much information on it. Don't do it again. Slap them on the wrist, train them, show them where to get the proper number. Okay. They do it twice. All right. Now I'm writing you up. And the third time, boot them because they don't learn.
Right.
Um, Now normally I like to do it to where it's like, hey, know how this stuff works. If you make a mistake, mistakes happen, especially if you're in a busy office, especially if you're under a man. So I'll go and do the 3 strikes rule, but as time goes by, it'll be like points on a license where, that third strike, all right, well, now you're only down to 2 strikes, or now you're only down to 1 strike, or now you're good to go. Don't screw up again. This is just one it's tricky to keep track of. If you have numbers that you always use, then yeah, it's nice to be able to program them or have them on a sticky note because that's not violating HIPAA in any way, shape, or form. I would always recommend that if you are going to be faxing a large amount of information, you let the person know, hey, I'm sending you a bunch of information now. I'm calling you in 10
Yeah.
minutes.
Yep.
Let me know you got it. This way, you guarantee that it got to the right place because if you didn't, then you can go and be proactive about, okay, hey, this got sent to the wrong place. Let's go and call that person that received it and say, hey, I sent you something incorrectly. Can you do me a favor and false it? And then, you handle it on your end.
No, absolutely. Got to have a protocol for that, and
Yeah.
got to be proactive. Is bottom line. No, 100%.
So,
So let's talk about some of the solutions. In summary, Jose, what solutions do you recommend for organizations to improve HIPAA compliance in faxing?
I would love to say that you don't need a fax machine, but that's not
Yeah.
reality. I would love to be able to say that, but that's just not the case. Just because of the way that different organizations work. So I would say that
Sure.
you doing it all in one is the easiest way to do it, like a printer, scanner, copier kind of setup. Um, One way you can limit issues, depending on your size of office, is only having certain hubs. So maybe the whole office has 2 printers. And those 2 printers are also fax machines. That way you can kind of keep track of everything. Make sure you have BAA with whoever owns the
Yes.
printer. make sure, either the office owns it or the IT owns it, or if, a leasing agency owns it, perfect. You got to make sure that you're proactive with that. Make sure that all the employees know how to use a fax machine, what numbers to do, what numbers not to do, how to learn, all those details of training individuals, and that they know the policies, that they understand that, hey, if every single time you fax something to the wrong place, that's a HIPAA breach. We got to handle this appropriately. Not always does it need to go to OCR. Oh, hey, we sent the wrong prior off, No, but we need to handle it just as seriously as every other kind of breach. We can just usually handle a fax machine internally without reporting it or without it being resulting in fines.
Right. Good
I
point.
did see a
Obviously,
question. Did
yeah.
you did you want to hit that one question that came in a little bit earlier?
Yeah, go ahead. Susie, she had
Um,
asked, why add data into the fax body? Will they not be able to see the fax body too? Was her question.
I mean, so the old way we used to do faxes, right, was the cover page and then all the information behind it. Now, if you're doing fax to email or anything like that, it's just all getting printed out anyways. The cover page, yeah, you can have the disclaimer on there and everything else. I'm guessing that's what Susie's referring to. So yeah, you can, no need to reinvent the wheel, but I mean, if you're doing fax to email or if it's just getting faxed and printed someplace else, they're going to look at it because we're like, okay, well, what is this? I don't even know. Is this supposed to go to my medical records department? Is this supposed to go to my bullpen where I'm getting everything set up for a new patient? Like what is this information? So I mean, I
Right.
guess Susie, I'd need a little bit more information on what exactly she's looking for. Because if I'm sending a fax, I'm gonna send the data in there.
Susie, if you can chime in, let us know, and we'll answer at the Q&A here. But one more thing before we get to the she's actually Susie mentioned that she's that she's got it now. Perfect.
Oh, okay. All right, cool.
So before we move to our Q&A, I just want to share a couple opportunities with you guys. Again, appreciate everybody being here on these webinars, and I hope you're finding this valuable. We do offer a range of courses. We do have obviously the subject matter today was HIPAA security related, but again, as I mentioned earlier, we do OSHA, HIPAA, and Medicare compliance. We do offer a free OSHA course. You can take the course, you get a downloadable PDF certificate at the end. OSHA does require that you or new hires do take that course within a 10-day period. If it's something that you haven't taken this year, highly recommend taking it. We'll be
Wait,
sending some links
wait,
out as
Ray.
well. Yeah,
OSHA's not 10 days.
OSHA is 10 days. Don't lie to me.
HIPAA is 10 days.
Oh,
OSHA's 30, I believe.
I'm gonna call your dad now after this.
I call my dad. Google
I'm gonna
challenge it.
call. No, it's 10 days. No, it's 10 days. It's in. You know what? I'm about to look up the regulation right now. I swear it's 10 days because I saw it. OSHAdepartment.gov. 10 days. Marlene, thanks for chiming in. Students can take that training as well. All you got to do, just have them go to epicourses.com, and they can register individually as long as they have a valid email address. No problem. Jose, it looks like you're looking it up right now, so I hope you eat those words. But in the meantime, I'm going to go over just a couple more of our offerings here. Obviously, if you guys are looking for something HIPAA related as well, we do offer a training bundle. It includes HIPAA privacy, HIPAA security, OSHA, and Medicare compliance training. If you're looking for something a little more comprehensive, we do offer what we call our ePHI Compliance Pro package. Jose mentioned it earlier. BAA agreements, why pay an attorney $350 an hour to create those templates for you? These are templates that we provide on this program. Not just that, but we provide policies, procedures that we keep up to date for you, as well as the training portion and all the policies, procedures, obviously regarding fax and all the topics that we've discussed so far. Other than that, If you're not sure what you're looking for, we're certainly open to speaking with you. We do offer free consultations. Again, I'm going to be sending an email out to everybody after this meeting. Feel free to book a 15-minute consult. We can discuss your needs, and we go from there. But other than that, again, appreciate everybody being in on this webinar. We're going to go ahead and open up for a quick Q&A, and feel free to chime in on the chat, and we'll get it going.
Questions today?
I got one that just came in
Okay.
privately, Jose. I don't know if you were able to see it, but
No.
it says, in the context of HIPAA compliance, what are the compliance for fax machines? What are the critical factors organizations should consider beyond the technical specifications to ensure security?
Wow, who gave you this one? An IT company? It's got multi.
It
Or is this
might
someone
be.
that's
It's a bit
legal?
loaded, but I think we've hit on some of those points. But go ahead. Go
Yeah.
ahead.
So outside of the technical, because remember, HIPAA security encompasses three areas, right? Physical, technical, and administrative. So if you're saying outside of the technical side of things, you're looking at the physical side. So who has access to the fax machine?
Hmm.
Keep in mind that incidental access is not an issue. So your cleaning service is not going to be an issue. It's going to be more along the lines of who has access to it day to day for information purposes. You don't want your patients having access to it, so on and so forth. Then administratively, your exposure would be on the policy side, and on the BAA side.
Right.
Because again, who owns the printer? So then you have a BAA with the person who owns the printer. If that's a brand new printer and you're older than brand new, then someone's going to ask you where those old hard drives are.
Sure. Sure.
Now, you may not need to actually store the hard drives because any of the PHI that's on there should be in the medical records for the corresponding patient. And I'm just going to nod my head like, yes, that person asking the question should be nodding their head, yes, up and down. So then you can just destroy the hard drive. If, however, there is unique patient information on there, you need to store it for the appropriate amount of time, depending on whether they're a minor or an adult, or if this is mental health related, or so on and so forth. So you've got a couple different factors there. Then on the administrative side, you also have the policies and procedures regarding use and training, and unexpected faxes received and sent. So if you are a Dr. Smith and you got sent a fax with patient information on it, what do you do with it? Do you send it back? Do you call the office and say, "Hey, we're the wrong Dr. Smith"?
Right.
Or are you like this one DME company that, threatened to sue a client of ours because they sent a fax wrong to them, and it was just a simple misunderstanding that they decided to blow completely out of proportion, and there was nothing really there. So, like, how difficult do you want to be? So,
This
that would
person wanted
basically
to remain anonymous, but he responded and it said he was shaking his head. Yes,
okay,
and he
perfect.
is an IT person, so I think
Okay, perfect.
so. No, no, good job
So
on
yeah,
that.
so I mean, I hope that answers that person's question in regards to
It did.
the other aspects, the other potential exposure vectors for HIPAA security.
No, absolutely. And Marlene, our HIPAA and OSHA certifications for students free. The OSHA course is a free course. Our HIPAA trainings are not. Our HIPAA trainings are paid. If HIPAA is what you need, I would recommend going with our training bundle. HIPAA and OSHA are bundled in with that program, as well as waste, fraud, and abuse. That would be my recommendation. Other than that, that closes out. I don't see any other questions coming in. That'll close out our Q&A for now. Next week's topic, we're going to be talking about security management and risk analysis. Jose, I don't know if think your dad might be running that one, but we'll
I have no idea. If I've already blocked off the schedule on my end, and if he
sure.
decides to bogart it, then you guys will have someone with English
I
that's not
know
as good
that's
looking
a
as mine.
I know that's a good yeah, that's a good subject for him. So but guys, if there's any topics or anything specific that you want us to touch on, please provide some feedback. Again, everybody's going to be receiving an email. We'd love to hear it. Right now we're just sort of going with what's popular or what we see, is most common. But there's
Also,
anything specific, let us know. We'd love to talk about it.
yeah, if there's also a specific use case, because
Yes.
all these breaches and everything have to be federally reported, I'll be more than happy to research that stuff because it's a drama. I love finding out how they screwed up, and
Yeah.
it can a lot of times it ends up being simple things that just blew out of the water because of how many issues there were or how systemic the issue was, like the one with Kaiser recently. So yeah, I mean, we can go into all of it. I mean, how all scripts got into it got ransomwared, and then they got
Yeah.
class action lawsuited by all of their
Saw
clients a
that.
couple years ago.
Hmm.
So, I mean, this stuff it can get a little bit into the weeds, but we want to keep it as entertaining for you guys as possible because this stuff can get dry.
Absolutely. Angela or Angelina, I'm sorry. You asked the question for instructors, can we receive certifications after this webinar? At this point, no, we don't offer some sort of certificate for participating, but this has been brought up before.
Ooh, but what
Let
you can do, Angelina, is once Ray publishes this presentation, you can use this as ongoing training for your employees. So you can be like, "Hey guys, we're gonna do a lunch. We're gonna do everybody's gonna grab lunch together. You just play this, and that's considered ongoing training."
Yes, and we will be publishing these videos on our YouTube channel. So, Angelina, I hope that answered your question. Stay tuned for that. We will be sending links out for those videos. Other than that, hey, Jose, I appreciate you joining in on this, everybody. Appreciate your time. Your time is valuable to us, and hope to see you guys on next week's webinar. Again, we're going to be talking about HIPAA security management and risk analysis. You guys take care. Have a good rest of your day, and we'll certainly see you on the next one. Take care, guys.
Bye.